The other benefit is that people now know they have something, and they have something objectively, and they are not held crazy by their doctors saying, oh, I can't do anything for you because I can't find anything. But if they know that they, for example, have these very important drug-related variants, they had something to grasp. And that in itself is sometimes very therapeutic.
Welcome to the Longevity Code, a podcast by the Longevity Center, Switzerland. My name is Dr. Erat. I'm your host today, and it's my great pleasure to welcome Professor Thomas Szucs. You are, of course, a professor not only in Basel, but also in the University of Beijing. And you're one of the co-founders, co-directors of the longevity or the genomics project at Hills London, which is Hills London Group, which is the largest private hospital group in Switzerland. So it's really a pleasure and an honor to have you here today.
Thanks, Anna.
So you are an expert. You're a professor in genetics. You're also specialized and you lead various projects and also departments in public health, in genomic medicine. And so, of course, the first question that I obviously will ask you is, what's the role when we compare nature to nurture and when we're talking about longevity and chronic disease? What do you think? What is your opinion?
It's the question of all questions, right? Mm-hmm. And I do think that the best analogy, or metaphorically speaking, the best way to put it is like looking at a cannon or a gun, and you would say loading the gun with your ammunition is the sum of your genes, and pulling the trigger is lifestyle, right? So you have a certain amount of genetic material that has been given to you, partly by your father and partly by your mother. And it's up to now your body to make something out of that. And we have learned over time that we can sometimes influence the way the body works with these genes.
That's brilliant, because I'm going to talk about various levels of genetic material. And when you already mentioned father, mother, that of course begs the question about mitochondrial DNA. So we inherit our mitochondria from our mothers. So what's the role, in your opinion, of mitochondrial DNA and also this maternal kind of passing on of material to the next generation?
Very simple. When patients ask me, like, what do you think that my longevity is going to be? I always ask, how old did your mother get? If she's still, or if she passed away, when did she pass away? What about your grandmother? So we all know that the maternal line is very essential to estimate your lifespan, right? So the mitochondrial DNA is passed through the maternal line. And that probably is one of the clues why longevity to some extent can be explained through the maternal heredity pathway. And as you know, the mitochondria are the batteries of the cell.
Sure.
So they play an extremely essential role in running the household of your energy capacity. So yeah, mitochondrial DNA, something that we should be looking at in terms of also lifestyle and longevity.
Do you think that can be already impacted in pregnancy?
Yes, definitely. We are learning over time how different factors, for example, also pregnancy, can influence the development of a new person, right? And so not only epigenetic factors come into play, but also the way that imprinting takes place. And imprinting is also very much associated with mitochondrial health as well.
So when we talk about, just for our viewers as well and our listeners, when we talk about genetics and epigenetics, what would be like a really simple explanation about what's the difference between epigenetics and genetics? Do you have that? Yeah.
Well, as you know, the DNA is the blueprint. And tells the body how the body should be producing proteins. Now, every gene needs to be switched on. And to give you one example where I think epigenetics plays a huge role is the switch, which we have to switch on that a gene produces a protein. Now, one way of not having the body produce the protein is to turn off the switch. That can be done by regulatory pathways. But also epigenetically, you could have a situation in which this switch, which we will now call promoter, is covered by, for example, methyl groups. So chemical groups. And they are epigenetically put on the promoter. And it's like putting chewing gum on that switch. So the body cannot put on that switch again to produce that protein. So the protein is blocked in its production because the switch cannot go on, because the chewing gum, which is the epigenetic molecule, is covering that.
So the methylation is kind of the chewing gum.
Yeah.
And in mammals, approximately 80% of all the CpG kind of islets are methylated. Can you measure that?
Oh yeah, definitely. I mean, we used to have an expression called the epigenome, which is the total sum of the epigenetic modifications that DNA is subject to. And we can map that very nicely. And actually, a couple of years ago, it was possible to create what we call the epigenetic atlas of the human cell, which is a pretty good picture of to what extent epigenetics is playing in relation to DNA.
Do you measure your methylation yourself as well?
No, that's a very good question. I haven't done it so far because we haven't in our lab set up the assays yet to do epigenetic measurements. But definitely, they do play a huge role. And we have a lot of drugs that we should be also very careful of using because, for example, I'll give you an example of valproate acid. That's a drug that we give, for example, in cases to prevent seizures.
Yeah,
right?
Epileptic seizures.
And it's very, very dangerous to give this drug into pregnant women. And we now understand why, because there's an epigenetic modification that takes place when we give valproic acid. So that's where we really have learned how important it is also with molecules, small molecules, especially small molecules, how we influence the epigenetic covering of the DNA.
Yeah, the chewing gum.
The chewing gum.
Yeah.
And it's not only methyl groups, it can also be acetyl groups. Or
Yeah. And getting back to this incredibly interesting example, does this medication also have an impact on the fetus and the DNA of the fetus?
Yes. We know that we have fetal abnormalities and miscarriages, which can occur when a woman, when she's pregnant, would take molecules or medications that would influence the epigenetic structure. But again, this is all beautiful life science where we are learning from minute to minute about what's happening also in terms of epigenetic modification.
I want to get back to the genetics in a second, but the third question that I'm burning to ask you is, of course, the telomeres, because the telomeres are kind of the end parts of the chromosomes, and we know that they have an important part in stabilizing the chromosomes, and they tend to get shorter the older we get. And, we learned so much from, if you remember, Dolly, the sheep, the first mammal that was cloned in, I think, 1995. So it's already quite a long time ago, but we learned so much from that and how she aged very quickly and she developed various cancers and things like that. So in terms of telomeres, oxidation, for instance, has quite a strong impact on an oxidative stress on the telomeres and whether the telomeres shorten quicker or not. What do you think about telomeres? In your career and your research projects, have you looked more closely into telomeres, and how can we make sure that telomeres don't shorten too quickly, because that obviously leads to aging and premature aging?
It's also the billion-dollar question.
Sorry, telomeres, I have to ask you these questions.
Telomeres and the measurement of telomere length have become of great interest when pharmacologists started studying the process of aging. And apart from just measuring oxidative stress, many research projects were also looking to which extent can pharmaceutical moieties, or small molecules or large molecules, influence telomere length, telomere shortening. Interestingly, some of the drugs that were able to be shown, at least in some of the animal models, was, for example, metformin, right? So metformin is one of those molecules which have been around for so many years. So it's also a safe molecule, and it's being tested in a huge longevity study, trying to find out to which extent metformin would also be able to reduce telomere shortening and to then sort of prolong lifespan. The first human experiment randomized trial, the best of my knowledge, still ongoing. So yes, telomere shortening, influencing the shortening of the telomere is very, very important.
In your lab, do you measure telomere stability in any way? Or if not, in other labs, how can you measure the stability of the telomere?
Yeah, unfortunately, we have not put up the assay yet. So let me just tell you, we'd be interested in understanding how such an assay could be established. And but we are looking into the science of it. We're looking also into commercially available assays that could be parametrized and run in our lab. But it's the place to begin. And a lot of people want to know about their epigenetic clock. Mm-hmm. A lot of people want to know, is my age biologically in line with my chronological age? Yep. These things, great interest.
So the epigenetic clock, the telomere stability, the mitochondrial function, and now we get into the traditional genetics, which I find absolutely fascinating because, as we talked before, nature and nurture, that's kind of the billion-dollar question, but nature most certainly has a huge role. Although the WHO states that 30 to 50% of all cancers are preventable through lifestyle changes or environmental changes or optimization. But nevertheless, 50 to 70% are not. So in terms of genetics and in terms of longevity, what do you think? When does it make sense to look at the genes? Are there any kind of, in your opinion, any kind of clear situations where you should really look at your genes and do they look at the entire genome or not? Or do you just look at various, specific genes?
The answer is always it depends. If you have, let me first start off. The first act that we always do when we talk about genetics is we want to understand the pedigree. We always start with the pedigree. That is your family history. We want to understand first, how have your siblings, how are your parents, grandparents, aunts, uncles, how does this all look like? Because a lot of the information that we try to get out of the patient, or sometimes it's not a patient because they don't have the cancer yet, is derived from the understanding of the pedigree. So we really have to understand this as a first act. Where we then see that there is a pattern which is highly suggestive of, for example, hereditary tumors, immediately we go into the mode of saying, yes, we have to look into this, and then we will do the sequencing of the DNA, usually by looking at these variants with panels. In some instances, when we have, for example, long genes that cannot be depicted very nicely or sequenced very nicely in the panel, we then go to the exome. But that's when we really start working on the DNA. The other question that you had is now if somebody has already got a cancer. The new medicine where we are in is that we now want to sequence the cancer. So that's huge, actually. The genetics of the cancer. And here comes now the most interesting part, is what happens if one of your cancer cells or parts of your cancer have genes that we know of that play a role also in hereditary cancer. So when I speak about hereditary cancer, it's a cancer risk that you can pass on to your children, and you have inherited some of the driver genes from your parents or grandparents. But the interesting things come now. You find something in the tumor. Let's say you find the breast cancer, the BRCA1 gene in one of your cancers. then you immediately have to ask yourself, is that variant also in all of my other body cells? And then you start going into what we call the germline, and we try to then compare the cancer cell lines, the cancer variants, and the germline variants. And that gives us a completely different picture in terms of your survival probability. And it gives a different picture on the treatment options that you might get.
So when we talk about longevity, obviously we also talk about us getting older. And for me personally, I'm very much curious and an advocate of increasing the quality of life and therefore also the health span. But the older we get, the more likely we are to develop certain cancers. And in men, of course, for instance, prostate cancer. So what about prostate cancer? That's also something where you can really look at the DNA in the tumor. How important is that? Because prostate cancer can be very aggressive or less aggressive. There are many approaches what to do with it when you get older. Do you just wait, or do you have to be proactive and do a surgery? So what's the role of genetics and determining the potential mutations in prostate cancers?
Okay, let's assume just for the moment that the prostate cancer is a homogeneous cancer, okay? So, which it is normally not. But let's assume it's homogeneous, and we look into the cancer, we sequence it, we find some variants. Then for me, it's absolutely clear if I find a germline variant in that tumor, that I really have to look at the germline as well and bring these two together. And then I will, if I'm in the unlucky situation that I really have now a tumor which is now going to influence my next couple of weeks and months and maybe years, I need to know, do I have driver mutations or other activity genes that might influence the growth of the cancer? But they also make it possible to treat the cancer because we might have drugs which would now address exactly this variant. And I mean, just to make it simple, that's why you can give, for example, a classical breast cancer drug to a prostate cancer patient, which we call off-label use. In many cases, it's off-label because we have just not had these trials yet of breast cancer medication in prostate cancers. But the world is now moving away from defining the organ.
Exactly. It's not organ specific anymore. Exactly. Yes.
When we studied, we learned that we have lung cancer, we have breast cancer, we have colon cancer. And today, I think we are on the verge of changing the nomenclature into a more agnostic modality that says, for example, we are now treating BRCA disease, we are treating KRAS disease or BRAF disease. And that means that we are targeting the genetic variant and not so much the organ, because it doesn't really matter where the organ is.
Yeah. You know, what's also incredibly interesting is that organs age differently. So in about 20% of us, our organs have completely different biological ages. So our heart might be, in your case, let's say 40, and your prostate might be 30, and your brain might be 20. So they are not all aging with the same speed or the same velocity. What do you think in terms of genes? What is the influence of genes on the differences in aging of various organs?
Well,
this is in Nature Medicine, actually. This is in October last year.
Oh,
so
really?
Yeah, it's a really good study. But
I have to pick that up. Yeah. But I think from a pathophysiological point of view, it all makes sense, right? If you have organs that are, let's call it stressed, because, for example, you might have cardiac stress because you're not a trained person. You might have problems with your rhythm, what have you. And let's just assume you have a problem in your heart. Then obviously it's quite clear that you will also be able to influence this with various factors, right? Let's say, is the aging due to oxidative stress? Yes, then we should give something which might take away the oxidation. I think also other environmental factors play a role. I'm a great believer in pH. And I would say this if I would not be seeing patients again and again. And they think it's normal aging. they ache all over the place. They ache. They have muscle aches. They don't take statins, but they have muscle aches. But they don't really have rheumatoid arthritis, that stuff. But it's just like, it's not really running smooth. And then I asked them to measure the pH of the urine. That's a good point. And then give them some carbonates to bring up the pH.
Yeah.
Because most people are just, not only metaphorically, but they are too sour.
Yeah.
They're too sour. And what is pH? I mean, pH is a function of all these Krebs cycles and other metabolic cycles. And by just giving them more, taking away the acidity, makes them move better, and the environment of the cells get better. So with this little trick here, I have seen a lot of people say, they call me up and say, "Hey, doctor, this is fantastic. I can move better. I don't feel this muscle pain anymore," just by taking away the acidity. And I think the same holds true for probably aging, that if you have a microenvironment which doesn't really suit a healthy aging process, these little tricks might help also to bring this into a more balanced situation.
I love that, because when we talk about hallmarks of aging and about mechanisms of aging, even though we know that the acidity has an impact, we don't really talk about it. This is really, really good point, I must say. I really like that, and particularly also such an easy measure as just measuring the pH of the urine. It's really quite an easy diagnostic. I mean, we do that actually every time we take a urine sample. So, and it's very cheap as well, inexpensive. So that's a really.
And then there's another factor that I want to bring up, because I just had a patient this morning. A patient, she had breast cancer several years ago. She had the cancer come back, and so she's about 80 years old. 80, right. And she is still on exemestane, as you know, some of these anti-hormone treatments. Okay, and she's not feeling well with those. And she knows it because when she takes them down, she gets better, and then she takes them again. So a lot of women have to take these things. But then she said to me, I want to get rid of all this. I'm so old, should. And then I'm not a psychiatrist, but I started talking about her because she gave me the impression phenotypically, this lady was not 80 years old. She was phenotypically, I think, 65, 67. So she had very, very good, looking. I mean, you could see not very many wrinkles. She had the turgor, which was good. So, and then I started saying, what gives you pleasure? And she said, I have a grandson, 2 years old. And then she started to talk a little bit about it. I played the psychiatrist. And then she started talking about this little 2-year-old that is absolutely a fantastic child. And she started to smile again and be happy. And I said to her, isn't it worthwhile to go through a little bit of hassle with the exemestane just to enjoy that? I mean, just to try. And she looked at me and said, yeah. And I said, I can do the genetics for you to see whether or not we can go down with the dose, because the exemestane is metabolized through cytochrome 3A4 or 3A5. So we could look at this and we could maybe go down with the dose without hampering or sort of reducing the anti-tumor effect of the exemestane. So do you know what I'm trying to get at?
Sure.
It's also the brain-body interface, mental health, that really plays a role.
Well, I mean, as you know, the Nurses' Health Study, which was initiated in 1976, arguably the longest longitudinal observational study in the world, which is still ongoing, clearly shows that one of the most important prognostic factors for longevity and for healthy lifespan and health span is human interactions, meaningful social interactions and reports.
The blue zone.
Well, the blue zone, exactly, the blue zone. But exactly that. Yeah. So without any doubt. But one last question. When we're talking about genetics and we're talking about healthy aging, in some of us, we do need at some point medications. We might also need statins because the cholesterol increases and we might really profit from that. In which cases, when we talk about pharmacogenetics or pharmacogenomics, in which cases do you think it is crucial to do a genetic test before we start, or when we're already maybe on the medication and might want to switch When is it crucial, in your opinion?
Definitely, it's crucial when patients have problems with their drugs, right? And some people, they clearly do show negative reactions, right? And these undesired effects are partially due to pharmacokinetic reasons, which are due to the genetics of pharmacokinetics, sometimes also pharmacodynamics. And so these people who have multiple drug-based intolerances, they are always subject to a quick look at their pharmacogenetics.
Yeah.
Be it transporters, be it cytochromes, the oxidation process, etc. Also, people who don't tolerate very well anesthesia, full anesthesia. These are my favorite patients. They come to me, and increasingly anesthetists and pain specialists send me patients because I could not sedate that patient. She was even waking up, and I was giving her tons of drug. And then you look at the genetics, and then you have some explanation. In order to improve the next anesthesia, for example, giving opiate-reduced or opiate-free anesthesia, that is a huge benefit for the patient. But also, if you can't necessarily do anything right away, the other benefit is that people now know they have something.
Yeah.
Right?
Yeah.
And they have something objectively. And they are not held crazy by their doctors saying, oh, I can't do anything for you because I can't find anything. But if they know that they, for example, have these very important drug-related variants, sure, they had something to grasp. And that in itself is sometimes very therapeutic.
So we already talked about nature versus nurture. And you as a genetician, of course, I would like to rather now ask you about nurture as a very, very last question. So you yourself, what do you do to nurture your mental health, to nurture your joy? Do you have a hobby that, really makes you wake up in the morning, makes you feel young and strong? And, how do you nurture yourself?
That's a very good question. I think positive mindset is always a good thing. Now, would you say it's nurture or is it nature? I think to some extent one can train this. Yeah. Thankfulness. Every time I wake up in the morning and I know I'm here, I breathe, I can move my legs, I can move my hand, everything is good. I'm alive. Great, fantastic. It's not so obvious to be alive at a certain point in time, right?
No, it's not.
And to be thankful.
Yeah.
To be thankful that.
Yeah.
And I think you can also train some people to think about the good things. Like I told you about the patient I had this morning. Try to nudge her to think about the positive things in life, the grandchild, right? And something starts switching. So I think mental happiness, mentality, positive mentality, see the glass half full, not half empty. I think that's very important. And I think you can train that. That's what a lot of coaches can do.
That's music to my ears.
And the next is music. And the next is obviously music.
Right.
I get my energy from music, not only listening to music, but I don't make music, but I conduct. And I try to work with symphony orchestra, trying to tell them how I would like to hear a music piece. And that is something which gives me great pleasure. Mm-hmm. And
it gives us great pleasure too, by the way.
Thank you.
Yeah.
And the third element is, sports. Now, I'm not the most sporty person, but there are sports where I say, this is my love. And I love to do it. For example, skiing. And why should I go to a gym? Well, I don't really like gyms, but I like the skiing.
Yes.
So do things that you like and do them as much as you can to enjoy what you're doing. But I think it's very hard to plant people into activities where they cannot switch their pleasure principle on. Does that make sense?
It makes total sense, and I couldn't agree more. Professor Thomas Szucs, it's always a pleasure talking to you and interacting with you and working with you. So thank you so much for this insightful conversation and for sharing your incredible expertise. And I truly look forward to the next episode of the Longevity Code. So please stay tuned. We have more guests coming up, and we look forward to the next episodes.